Let's start with the definitions of agonists and antagonists in pharmacology. 1. Agonists are drugs or substances that bind to specific receptors in the body and activate them, producing a biological response. They mimic the action of endogenous substances, such as hormones or neurotransmitters, and elicit a physiological effect. Agonists can have varying levels of efficacy, meaning they can produce a full response or a partial response. Examples: epinephrine, it acts as an agonist at adrenergic receptors, producing effects such as increased heart rate, bronchodilation, and vasoconstriction. Morphine, it is an agonist at opioid receptors, providing analgesic, pain-relieving effects. 2. Antagonists are drugs or substances that bind to specific receptors in the body and inhibit their activation by endogenous substances or other agonists. By blocking the receptor, antagonists prevent the normal physiological response that would be produced when the receptor is activated. Let's explore the principles of how agonists and antagonists work. 1. Agonists are molecules that bind to a receptor and activate it, mimicking the action of an endogenous substance. When an agonist binds to its target receptor, it triggers a series of intracellular events that lead to a specific physiological response. Agonists can either be endogenous compounds, e.g., neurotransmitters, or exogenous substances, e.g., drugs. There are two types of agonists. A. Full agonists. These agonists bind to the receptor and produce a maximal response, fully activating the receptor and initiating the entire cascade of signaling events. B. Partial agonists. These agonists also bind to the receptor but produce a submaximal response, activating the receptor to a lesser extent compared to a full agonist. Agonists can have various effects depending on the specific receptor they target and the signaling pathways they activate. For example, an agonist for a specific neurotransmitter receptor can enhance neuronal activity, leading to increased neurotransmission. 2. Antagonists, on the other hand, are molecules that bind to a receptor without activating it. By binding to the receptor, antagonists prevent endogenous substances or other agonists from binding and activating the receptor. As a result, they inhibit or block the receptor's normal function. Antagonists can be classified into two main categories. A. Competitive antagonists. These antagonists compete with agonists for the same binding site on the receptor. If a competitive antagonist occupies the receptor, the agonist is unable to bind effectively, leading to a reduced response. Competitive antagonists can be overcome by increasing the concentration of the agonist. B. Non-competitive antagonists. These antagonists bind to a different site on the receptor, not directly interfering with the agonist's binding. However, their binding alters the receptor's conformation or function, preventing or reducing the agonist's ability to activate the receptor. Antagonists are widely used in pharmacology for various purposes. For example, they can be used to block the effects of endogenous substances or agonist drugs, reverse the actions of certain medications, or modulate receptor activity in specific therapeutic contexts. It's important to note that the terms agonist and antagonist are relative and depend on the specific receptor and physiological system being studied. A molecule acting as an agonist for one receptor may act as an antagonist for another, depending on its effects in that particular context. A molecule acting as an agonist for one receptor may act as an antagonist for another, depending on its effects in that particular context. A molecule acting as an agonist for one receptor may act as an antagonist for another, depending on its effects in that particular context.